for this news conference of Health and Human Services. To enhance the safety and well-being of our entire community, our teams at the Lincoln Police Department and the Lincoln Emergency Communications Center are committed to providing our community members with mental health support and services. And this morning, we're here to announce a new and powerful partnership between the Lincoln Police Department, the Lincoln Emergency Communications Center, and the 988 Lifeline that provides a significant boost to our capacity to respond to mental health calls for service. The 911-988 partnership enables our 911 emergency dispatchers to connect people in suicidal crisis or emotional distress to the 988 Lifeline's trained mental health professionals and resources. And like the alternate response program that we rolled out last summer, this new program gives our emergency dispatchers an additional resource if they determine that a call does not require law enforcement. Lincoln is the first city in Nebraska to establish a 911-988 partnership, further proof of our commitment to effectively and appropriately and compassionately responding to individuals experiencing mental health challenges and to providing our officers with more time to focus on calls that do require law enforcement. I'm so proud of the work of our LPD and Emergency Communications Center teams and want you to have the details of their amazing work. And here to provide them is Lincoln Emergency Communications Center Manager Jessica Loves. Jessica.
Thank you, Mayor. At the Lincoln Emergency Communications Center, we are trusted with providing the appropriate resources to our community members in an emergency, in their time of need. We are excited to launch this new targeted response to those who reach out experiencing a mental health crisis. The collaboration between 988 and 911 empowers us to connect the caller with the most appropriate response during the crisis, which might be connecting them to a mental health professional. This is now possible through our partnership with the Nebraska 988 program. To highlight the significant importance of this, I would like to share some brief statistics from the Lincoln Emergency Communications Center. During the last 6 months of 2023, our team answered just under 6,000 calls from individuals experiencing a mental health crisis. Each of those times, we were limited to sending a law enforcement officer when officers were available to respond. Most of these calls were ones in which the expertise of a 988 crisis counselor would be more effective in addressing the caller's needs. While we provided a response to each situation, we did not have the ability to provide the type of services that 988 can. Services of crisis counselors trained to promote the future well-being of our callers. We are proud to be a part of the first collaboration in Nebraska between 988 and 911 at the Lincoln Emergency Communications Center. We are grateful to the University of Nebraska Public Policy Center, Department of Health and Human Services, and Nebraska 988 for their partnership and support in the development of this process. It remains a priority that our community members trust that placing a call to 911 will connect them to the right resource in their time of need. As an added benefit, this new partnership will enable our public safety teams to more efficiently utilize personnel, time, and resources while recognizing the critical role 988 plays in responding to mental health crises in Nebraska.
Thank you so much for your leadership, Jessica. It's been so amazing to see it emerge. Thank you for all you do for the emergency crisis response. One of our primary partners in this effort is Boys Town, which operates the official call center in Nebraska for the 988 Lifeline. And here to provide more details on how this partnership will advance our mutual goals is Kyle Kinney, Program Manager for 988 Nebraska. Thank you so much for being here.
Thank you. Thank you, Mayor. Good morning. It is great to be here. Boys Town would like to first thank our partners in this great program, the Department of Health and Human Services, Division of Behavioral Health, the University of Nebraska Public Policy Center, Lincoln's Emergency Communications 911 Center, and the City of Lincoln. The 988 crisis system began operations in July of 2022. Since implementation, the 988 Nebraska Suicide and Crisis Lifeline has taken over 42,000 calls, chats, and texts from people in mental, behavioral, substance use, or suicidal crisis. The reason for the 988 crisis system is to respond to suicidal crisis with mental and behavioral health crisis services. Our goal is providing the right service at the right time, allowing our partners in emergency services to do what they do best and to do what Those are needed to help those in the communities facing challenging times. Since implementation, 97% of calls to 988 Nebraska were able to successfully de-escalate the situation and safety plan over the phone, meaning these callers do not end up needing emergency services like law enforcement, emergency medical services, the emergency rooms, or jail. Instead, callers reach our crisis counselors and find folks who will work to understand the crisis, assess the safety risks, explore options for safety, and develop a plan. These counselors will help them navigate through resources and follow up to make sure their needs have been met. We want each and every caller to feel like they have the help they need. Again, we thank you for letting us be a part of this great program, and we do look forward to partnering in service to the Lincoln-Lancaster community, allowing people in crisis to find the right help at the right time. Mayor?
And thank you for all of your partnership and collaboration, and we can do this without you, so thank you. We anticipate that the 911-988 partnership will bring benefits to our broader community, and here to talk more about what that looks like is Dr. Steve Coursey, the Chief Executive Officer for the Nebraska Department of Health and Human Services. Dr. Coursey, thank you so much.
Thank you, Mayor. Thank you. I'll begin by extending my gratitude to each of the partners present here today. Their exceptional efforts play a critical role in supporting all citizens in Nebraska. The seamless interoperability between 911 and 988 underscores our collective commitment to ensuring that Nebraskans experiencing thoughts of suicide or a mental health crisis are promptly connected with the appropriate resources and support. With 988 in its second year of service, it's important to recognize that some community members may not be fully aware of how to utilize this resource during a mental health crisis. Individuals often resort to calling their on-call doctor, reaching out to 911, or visiting an emergency room instead of utilizing 988. 988 truly emerges as a vital component in linking Nebraskans with community-based services, effectively reducing the reliance on law enforcement and hospital services during mental health crises. The three fundamental pillars of 988 include, number one, someone to call. Those are the trained crisis counselors at Boys Town. Number two, someone to respond. Those are the mobile crisis response teams across the state. And number three, somewhere to go. This is connecting individuals with community-based services. 988 serves as a valuable resource for everyone, individuals in crises, providers, schools, and advocacy groups alike. We encourage everyone to actively promote awareness about 988 by distributing informational handouts, displaying posters in public areas, including 988 in your voicemail, and listing it as a resource in safety plans. We strongly encourage any Nebraskan experiencing thoughts of suicide or a mental health or substance use crisis to call, text, or chat with 988 to connect with trained, compassionate, and accessible care. It's crucial to remember that regardless of your situation, you are not alone and help is readily available. A special note of gratitude goes to Mayor Gaylor Baird for her invaluable support in highlighting the significance of this pilot program and spreading the word about 988, which stands as a valuable resource for our community. Thank you all for your commitment to the well-being of Nebraska. Madam Mayor.
Thank you so much, Dr. Coursey. This new partnership reflects the priority that we place on mental health and to ensuring that anyone in our community who needs a lifeline gets one. And thanks to the work of our public safety professionals and our community partners and the state, that lifeline is now just a phone call away. And with that, we would be happy to answer any questions that the media may have.
Yes. If somebody calls 911 and is thinking about doing harm not only to themselves but to others, is this something that will be jointly answered to by 988 and 911, or exactly how would that work?
Again, through this collaboration and the partnership with these individuals standing here with me, we've spent many, many hours over the months just working through what those protocols look like so that we are providing not just consistent service, but an expected service for our callers. So if there's anything that places immediate harm, we're still sending a law enforcement response. We are definitely going to be there for our community members. We're just looking to this partnership with 988 as sometimes there's an alternative way to be there with our community members if that immediate threat does not exist.
I think it's going to kind of go back to this question. Going to go back to you. So maybe I missed it, but how is this going to be different than what it is now? People are still going to be calling 988. People are still going to be calling 911. Are you just now going to start communicating with each other, or what is exactly this partnership going to look like?
This partnership, I think, is really going to give us the opportunity to educate excuse me, members of our Nebraska communities that maybe are not as familiar with just how vast those services are through the 988 program in the state of Nebraska. So through 911, those conversations will happen with our callers. It's definitely a collaboration regardless of if it's for mental health services or anything else when you dial 911. So through that conversation, through assessing that protocol, we speak with the community member and we work towards seeing if 988 is a great alternative response for them.
So you're saying is that previously, if somebody called 911 because they were having a mental health crisis, you wouldn't have educated them about 988 until now?
We can definitely share that education. We just did not have that connection piece from center to center to make that connection in the moment. So, definitely our law enforcement officers are equipped with that education of what 988 is as a resource. They can share that education when they go out into the public, but still we're missing that opportunity to possibly connect them where they're at the time, and that resource of 988 in that moment really may be the best response for them.
So basically you can now dial in 988 and get them connected at the same time.
We are fortunate to have a direct line to their
Gotcha.
center.
That makes sense.
So this might be a Kyle question. So with this partnership, I'm assuming that you're expecting that probably the call volume is going to raise because most people probably call 911 when they're in some type of emergency or they're feeling some kind of way. So are you guys have hired more staff, or exactly how is that looking like?
Yeah, no, we're definitely anticipating call volume increasing. I think that's what the nice part about this being a pilot is we can assess on the fly a little bit and hire as we need. We've always had great partnerships with the Department of Health and Human Services, who funds the program and funds the service. And so working with them hand in hand along the way to, all right, we need to increase hiring, increase staffing, ultimately making sure that we're managing the end game of service levels, answer rates. So we've always maintained a really high answer rate in really fast periods of time. So since implementation, 95, 96% of calls have been answered within 9 seconds of ringing through the routing. So it gets us, we answer the call, and that's the ultimate goal. Whether they're coming from 911 or from the general community, we want to be able to answer at a high rate quickly.
And is that within those 10 seconds, is that kind of what you're trying to strive for?
That's still our goal. That certainly exceeds our expectations. We do a pretty good job, if I don't mind saying so myself, because the state of Nebraska has said we want to do this right and we want to do this well, and they've put the resources in place to do it.
So how will this, if you will, complete the mental health trifecta? You have the 988, you have 911, and you have the 911 alternative response protocol that we have talked about before. How will this kind of all mesh together now?
I'll let our subject matter expert here speak to that, but I do want to say that public safety is our top priority as an administration, and we're really proud of the response that all of our public safety professionals can provide. And we value partnerships, so we are continuously improving and enhancing our services to meet the moment. Alternative response helps us address folks who are on the streets and help them connect to services. They may have behavioral and mental health issues that are a part of that. This new program has helped to target in a crisis intervention, so we can help people take that important pause to recognize that they are valued, that they are loved, and that there are services here for them in a moment and to preserve their life. And we'll continue to iterate with our co-responder model as we build that out with federal grant support to help make sure that folks who are not at the edge of suicide still have access to supports that they may need to help them get more stable in their life. I don't know if there's anything you want to share more about.
Yeah, I think I was going with more like the co-responder model, where like mental health providers and services will go out to calls with LPD sometimes.
I mean, let's make sure we give LPD a lot of credit for the long history of their partnership with the Mental Health Association of Nebraska. We have been working with peer specialists for years. We've had community health endowment support for that program. We've brought it in and given it more funding as a city because we know that there are ways to really ensure longer-term solutions with appropriate service providers that can help ensure people are stable and on track. but we're so grateful for that long history, and we're building and improving on it because we're just dedicated to continuous improvement and excellence at LPD. Do you want to add? Go ahead.
Sure. Might be a slightly biased answer, but I personally serve in the city of Lincoln because Lincoln has never faltered from being committed to the safety and well-being of their community members. It's evidenced not just in the Lincoln Police Department, but I see that, evidenced across the city. So from a 911 perspective, nobody calls us on their best day. They call us in those dark moments. And individuals in that crisis, regardless of what that crisis may be, sometimes it's very challenging to see outside of it, to know what the resources available to you are. It's why you're typically calling 911, because you're not familiar with what your community provides at that time. So with being in 911, I think we really just have such a great responsibility that when our community members are calling, they're in that dark moment, that we have that education, we have that ability, and we've put the foundation for those connections in place for that community member. And this is just an extension of our services in that way.
Mayor, you kind of mentioned funding. Is there any kind of an increased cost to having this partnership?
Okay. There is not. This is a partnership that exists between our two centers. The 988 Center has put an extra line in place that is dedicated to the 911 professionals across the state of Nebraska, but no additional funding was needed to make this possible.
Does 988 have other partnerships with other law enforcement 911 centers?
So at this time, no. So this partnership is really intended to be the pilot project for the state of Nebraska, so that as future 911 centers and local law enforcement agencies want to come online following the kind of the protocols that come out of this pilot, they'll be able to do that at that point. So that's the ultimate goal, is that it would be available and accessible to each of those 911 centers across the state. But right now, this is the first.
Do you only have one call center for 988?
For Nebraska, yes.
Are there talks about expanding that? Because, I mean, Nebraska's rather large. Somebody out in the Panhandle may, not need somebody here in the eastern part of the state. So are you looking to possibly expand and to have different regional centers for 988?
We service the entire state, and we really the utilization, so the number of calls, really follows population trends. So we're currently serving, the Scottsbluff community equally to how we're serving the Omaha community or the Lincoln community. We're definitely at a point where we're still able to maintain those service levels. So the answer rates, answering calls. Through the Division of Behavioral Health, we've got partnerships with the local providers across the state. We partner with each of the behavioral health authorities in each of the regions of the state to look for your same day, your next day resources, mobile crisis response, those kinds of things. So right now, ultimately that's their decision, but at this point, no, I don't believe so, because we're serving at a very high level. We're not running into service deficits from the 988 perspective at all.
How many members do you have on your staff taking calls?
Sure. So it varies by time of day and day of the week. Our busiest time is kind of at 7, 8 o'clock to 2 a.m. So we're going to have the most staff there. You're going to have 9, 10, 11, depending on the day. Your slower times, you're going to have 5 to 7 from a crisis counselor perspective. So we staff to volume, basically, is how that works. And the volume has steadily increased ever since implementation. We had real good background with the suicide prevention Lifeline. Boys Town was a provider for that for the last 25 years for the state and nationally. So really had a good idea where we were going to start from, and have been able to manage the increases ever since. So I'm sure they would let me know if hey, we need to have a chat if things aren't going well. But at this point, we haven't had that conversation. So I would let them answer if they've got other thoughts on that answer. But
Kyle, I would say the metrics are fantastic.
thank you.
Any other questions? Well, we are so pleased to be piloting this program here in Lincoln as we work to become the safest and healthiest capital city in the country. I want to say thank you again to Dr. Corsi and the state of Nebraska, Department of Health and Human Services, and to Kyle Kinney and to everyone at Boys Town. Thank you so much. And of course, to our teams at LPD and the Emergency Communications Center, thank you for your leadership. We are so pleased to be able to lift up this resource and hope that more people understand that help is a phone call away.